The term psychological disorder is sometimes used to refer to what is more frequently known as mental disorders or psychiatric disorder. Mental disorders are patterns of behavioral or psychological symptoms that impact multiple areas of life. These disorders create distress for the person experiencing these symptoms. Have you ever felt anxious, maybe before a big test or an important job interview? A half an hour or even an hour before, you get butterflies in your stomach and walking into the room nervously. You go over questions and answer in your head and despair that you should have started prepping months ago instead of just last week. Once the test or interview is over, you feel relieved. It went fine. You remember everything you needed and your heart rates return to normal. This kind of anxiety is a natural and normal response to a stressor like an interview or a big test. But imagine if you've started worrying about the interview a week in advance and had been unable to concentrate on anything else in the meantime. Imagine if afterward, instead of feeling relieved, you continue to worry. This kind of anxiety is out of proportion to the stressor that triggered it and represents one kind of anxiety disorder, a disruptive condition that can interfere with the functioning in daily life. Let's explore various types of anxiety disorder, including generalized anxiety disorder, phobias, and obsessive-compulsive disorder. There are many types of anxiety disorder. The kind we just described, which would cause you to worry for weeks about an interview, is known as generalized anxiety disorder, abbreviated as GAD. It is fine to worry about the interview, but is worrying all week that is symptom of disorder. Generalized anxiety disorder can also cause physical symptoms like fatigue, headache, nausea, trembling, and insomnia. You may have felt some of these in response to normal passing anxiety. Maybe you have felt it before a big important test. But imagine feeling that way all the time in response to little things. And you've got some idea what it's like to live with generalized anxiety disorder. The disorder seems to have many possible causes. It's probably genetic, since it tends to run in families, but has environmental causes as well, since it's sometimes triggered by experiencing normal stress. It's also been associated with addictions to alcohol. The part of the brain that processes fear, called the amygdala, has also been related to generalized anxiety disorder. It seems like if its connection to the rest of the brain are interrupted, it can result in increased anxiety. This disorder is marked by excessive worry about everyday events. While some stress and worry are a normal and even common part of life, generalized anxiety disorder involves worry that is so excessive that it interferes with a person's well-being and functioning. Another anxiety disorder you might be familiar with is called a phobia. Some people also have social phobias or anxiety that is produced by having to interact with other people. Fears in general of social interaction is known as social anxiety. Have you ever felt nervous before going to an event where you might not know everybody? If so, you have experienced mild temporary social anxiety. Social anxiety only becomes a disorder when it is out of proportion, constant, or debilitating. If your anxiety actually prevented you from attending any social functions, you would have social anxiety disorder. Phobias are often understood in terms of classical conditioning, like Pavlov's experiments. Pavlov caused dogs to salivate at the ring of a bell by presenting the food and ringing the bell at the same time. Though the dogs initially salivate because of the food, they came to associate the presence of food with the bell sound and would salivate in anticipation when there was only the sound of the bell. Though the dogs initially salivate because of the food, they came to associate the presence of the food with the bell sound. Some psychologists think that phobias may be formed by classical conditioning in a negative sense. Obsessive-Compulsive Disorder, or OCD, is a mental health condition which is categorized by obsessions and compulsion that interferes with daily life. A person must experience obsessions, compulsions, or both. Symptoms of OCD usually appear gradually and can be long-lasting if not treated. People with OCD may experience symptoms of obsessions, compulsions, or both. Such symptoms interfere with many areas of life, including school, work, relationships, and normal daily function. Obsessions are thoughts, images, or ideas that lead to distress or anxiety. They won't go away, they are unwanted, and they are extremely distressing or worrying. Some common symptoms of obsessions include aggressive thoughts about other people or oneself, a need to have everything in a certain order, fears of germs, unwanted thoughts of forbidden or taboo topics such as religions or harming others. Compulsions are repetitive and excessive behaviors that the individuals feel that they must do. These actions are done to reduce anxiety. Compulsions are behaviors that have to be done over and over again to relieve anxiety. Compulsions are often related to obsessions. For example, if you're obsessed with being contaminated, you might feel compelled to wash your hands repeatedly. However, this is not always the case. Some common compulsions include counting things over and over again, excessive washing or cleaning, ordering things in a particular or symmetrical way, repeated checks such as checking that the door is locked or that the oven is off. The obsessions and compulsions must also be time-consuming, taking up an hour or more per day, or cause significant distress or functional impairment. It is important to be aware that not all habits or repetitive behaviors are synonymous with compulsions. Everyone has repeated thoughts or engages in double-checking things from time to time. In order to be diagnosed with OCD, their experience is categorized by an ability to control their thoughts or behaviors even they recognize that they are excessive or irrational. Spending an hour or more a day on these obsessions and compulsions, experiencing significant problems and disruptions in daily life because of these thoughts and behaviors. Not gaining pleasure from thoughts or behaviors, but engaging in compulsive behaviors and may provide a brief relief from the anxiety that the thoughts cause. The causes of OCD may include biological factors, family history, genetics, and stress. And the treatment for OCD may include medication, psychotherapy, or a combination of the two. Psychological therapies are also highly effective treatments for reducing the frequency and intensity of OCD symptoms. Effective psychological treatment for OCD emphasizes changes in behavior or thoughts is cognitive behavioral therapy or CBT. Schizophrenia is a chronic psychiatric condition that affects a person's thinking, feelings, and behavior. The diagnostic criteria specify that 2 or more symptoms of schizophrenia must be present for a period of at least 1 month. One symptom must be one of the following: delusion, which is the beliefs that conflict with reality; hallucinations, which is seeing or hearing things that aren't really there; disorganized speech, which means words do not follow the rules of language and may be impossible to understand. And the second symptom may be one of the following, like confused thinking, bizarre behavior or movement, the inability to initiate plans, speak, express emotion, or feel pleasure. Diagnosis also requires significant impairments in social or occupational functioning for a period of at least 6 months. The onset of schizophrenia is usually in the late teens or early 20s, with men usually showing symptoms earlier than women. Earlier signs of the condition that may occur before diagnosis include poor motivation, difficult relationship, and poor school performance. Mood disorders are categorized by periods of unusual extreme emotions. Let's explore mood disorders such as major depression and bipolar disorder and understand the association of the suicide mood disorder. Depression or major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feeling of sadness or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at school and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once you enjoyed, changes in appetite, weight loss, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity such as inability to sit still or pacing handwriting or slow movements or speech, feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical condition can mimic symptoms of depression, so it is important to rule out the general medical causes. Depression can affect anyone. Several factors can play an important role in depression, such as biochemistry, genetics, personality, and environmental factors. Several factors can play a role in depression, such as biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. Low levels of serotonin and norepinephrine have been observed in depressed patients. Genetics, personality, and environmental factors. Bipolar disorder, also known as a manic depression, it is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel overly happy and energized, and other periods of feeling very sad, hopeless. In between those two periods, they usually feel normal. You can think of the highs and the lows as two poles of mood, which is why it's called bipolar disorder. The word manic describes the times when someone with bipolar disorder feels overly excited and confident. These feelings can also involve irritability and impulsive or reckless decision making. About half of the people during mania can also have delusions, which is the believing that things aren't true and that they can't be talked out of, or hallucinations, which means seeing or hearing things that aren't there. Hypomania describes the milder symptoms of mania, in which someone does not have delusions or hallucination, and their height symptoms do not interfere with their everyday life. The word depressive describes the times when the person feels very sad or depressed. Someone may feel the same mood state several times before switching to opposite mood. These episodes can happen over a period of weeks, months, and sometimes even years. How severe it gets differ from a person to a person. Symptoms of mania or the heights include excessive happiness, hopefulness, and excitement, sudden changes from being joyful to being irritable, angry, and hostile, restlessness, rapid speech and poor concentration, increased energy and less need for sleep, making grand and unrealistic plans, showing poor judgment, drug and alcohol abuse, becoming more impulsive, less need for sleep, less of an appetite, larger sense of self-confidence and well-being, being easily distracted. And during the depressive periods, which is the lows, a person with bipolar disorder may have sadness, loss of energy, feelings of hopeless or worthlessness, not enjoying things they once liked, trouble concentrating, forgetfulness, talking slowly, inability to feel pleasure, uncontrollable crying, trouble making decisions, irritability, needing more sleep, insomnia, appetite changes that make you lose or gain weight, thought of death or suicide, and attempting suicide. So what are the treatments for bipolar disorder? Medication is the main treatment and usually involve the following: mood stabilizer and anti-anxiety medication or sleep medicines such as psychotherapy or talk therapy is often recommended too. There are several different types. Options can include interpersonal and social written therapy, cognitive behavioral therapy, psychoeducation, family-focused therapy, etc. Other treatment options for bipolar disorder can include electroconvulsive therapy or ECT. Small doses of electricity shock the brain and set off a small seizure to kind of reboot it and change the balance of the certain chemicals. Lifestyle changes may also help. For example, get regular exercise, stay on the schedule for eating and sleeping, learn to recognize the mood swings, get support from friends and groups and families. Keep a symptom journal or chart. Learn to manage stress. Find healthy hobbies or sports. Don't use alcohol or use recreational drugs.